Hello everyone, welcome to my YouTube channel. In this session, I am going to discuss about maxillary nerve. Maxillary nerve, it is a second division of trigeminal nerve. It is the second division of trigeminal nerve and it is a purely sensory nerve. It is a purely sensory nerve. So next we'll see about the course of the maxillary nerve. So the maxillary nerve, once it arises from the trigeminal ganglion, it proceeds forwards in the middle cranial fossa. So if you see, this is the middle cranial fossa now. Here we can see trigeminal ganglion. From the trigeminal ganglion, an important branch, that branch is called as the second division, that is the maxillary nerve. So this maxillary nerve will be passes, that is, or you can say this proceed forwards in the middle cranial fossa. It passes along the lateral wall of the cavernous sinuses and leaves the middle cranial fossa by passing through the one important foramen. That foramen is called as foramen rotundum, and finally reach the pterygopalatine fossa. So this is the foramen rotundum. So this is the course within the middle cranial fossa. So in the middle cranial fossa, it proceeds forwards and it passes along the lateral wall of the cavernous sinuses and leaves the middle cranial fossa by passing through the foramen rotundum and finally reaches the pterygopalatine fossa. In the pterygopalatine fossa, it undergoes straight course and going to suspend the one important ganglion, that is the largest peripheral parasympathetic ganglion, that is the pterygopalatine ganglion. And leaves the pterygopalatine fossa by passing through the inferior orbital fissure and reaches the orbit. Now once it enters into the orbit, now this nerve is called as infraorbital nerve. This infraorbital nerve, it passes along the floor of the orbit. So this is the floor, it passes along the floor of the orbit. It passes along the groove and canal and finally emerge out from the infraorbital foramen. Once it emerges out from the infraorbital foramen, it gives a three terminal branches. Number one will be the palpebral branch. Number two, nasal branch. Number three, labial branch. So these are the three terminal branches which is arises from the infraorbital nerve. Now let's see the branches of maxillary nerve. First, in the middle cranial fossa, what's the name of the branch? Number one, that is the meningeal branch. Meningeal branch. This meningeal branch is going to supply the durameter of middle cranial fossa. In the pterygopalatine fossa, it gives rise to three branches. Number one, ganglionic branch. Number two, zygomatic branch. Number three, posterior superior alveolar nerve. So this is the three branches which is coming from the pterygopalatine fossa. Now this is the ganglionic branch. So this ganglionic branch is going to suspend the one important ganglion. That ganglion is called as pterygopalatine ganglion. So this ganglionic branch convey sensory fibers from orbital periosteum, from mucous membrane of nose, from palate and pharynx, and this branch also contain postganglionic secretory motor fiber to lacrimal gland. Next we'll go to the zygomatic branch. Now you can see in this diagram, this is the zygomatic branch. This zygomatic branch, it's enter into the orbit through one important fissure. That fissure is called as inferior orbital fissure. Now once it enter into the orbit, this zygomatic branch divides into two branches. Number one will be the zygomaticofacial nerve. Number two will be the zygomaticotemporal nerve. So these are two important branches which is present in the orbit. So this zygomatic facial nerve, it reaches the face by passing through the foramen which is present in the zygomatic bone. It going to supply the skin over the cheeks because this is a sensory nerve. And next, this zygomatic temporal nerve, it reaches the temporal region and going to supply the skin over the temporal region. So this zygomatic temporal nerve also contains secretory motor fiber to the lacrimal gland. And then one more branch, that is, we'll see the posterior superior alveolar nerve. So this is the posterior superior alveolar nerve. So this posterior superior alveolar nerve, it passes downwards. It passes downwards and passes to the foramina which is present in the posterior surface of the maxilla and supplies the one important sinuses, that is the maxillary sinuses, and also it's going to supply the third molar teeth and adjoining gums. And this posterior superior alveolar nerve, it breaks up and gives rise to superior dental plexus. And next branch, in the orbit, what are the branches? So in the orbit, it gives rise to two branches. Number one will be the middle superior alveolar nerve. In the orbit, it gives rise to two branches. Number one will be the middle superior alveolar nerve and anterior superior alveolar nerve. You can see this is the, in the orbit, one branch, this branch is the middle superior alveolar nerve. So this middle superior alveolar nerve, it passes downwards along the lateral wall of the maxillary sinus and breaks up to form a superior dental plexus and going to supply the premolar teeth and adjoining gums. And you can see this is the anterior superior alveolar nerves. So this anterior superior alveolar nerve, it passes downwards along the anterior wall of the maxillary sinus, or you can say one important canal is present. That canal is called as canalis sinuses. So it passes through the canalis sinuses and divides into two branches. One branch will be the dental branch and will be the nasal branch. So this anterior superior alveolar nerve, it gives rise to two branches. Number one will be the dental branch. Number two will be the nasal branch. So this dental branch breaks up to form a superior dental plexus and going to supplies incisor teeth and canine teeth and adjoining gums. Whereas the nasal branch is going to supply the lateral wall of the nasal cavity including inferior meatus. And next we'll go to the terminal branches. That is the palpebral branch, nasal branch and labial branch. So this palpebral branch, it passes, so here we can see this is the infraorbital foramen. So this palpebral branch is going to supply the skin of the lower eyelids, and nasal branch is going to supply the skin of the side of the nose, whereas the labial branch, it passes downwards, it is going to supply the skin of the upper lip. So this is about the maxillary nerve. So I will give the brief description about the maxillary nerve now. So the maxillary nerve, it is a second division of trigeminal nerve and it is a purely sensory nerve. So it proceeds forwards in the middle cranial fossa. In the middle cranial fossa, it passes along the lateral wall of the cavernous sinuses, and then it leaves the middle cranial fossa by passing through the one important foramen. That foramen is called as foramen rotundum. So once it leaves the foramen rotundum, it finally enters into the one important fossa. That fossa is called as pterygopalatine fossa. So in the pterygopalatine fossa, it undergoes a straight course and leaves the pterygopalatine fossa by passing through the inferior orbital fissure and finally reaches the orbit. Once it reaches the orbit, this nerve is called as nerve infraorbital nerve. So this in the orbit, this infraorbital nerve, it passes along the floor. First it passes through the groove and passes through the canal and finally emerges out from the infraorbital foramen. So once it emerges from the infraorbital foramen, it gives rise to 3 terminal branches. Number 1 will be the palpebral branch, number 2 will be the nasal branch, number 3 will be the labial branch. Now let's see the branches. In the middle cranial fossa, it gives a meningeal branch. It is going to supply the durameter of middle cranial fossa. In the pterygopolitan fossa, it is going to give rise to 3 branches. Number 1 will be the ganglionic branch. Number 2 will be the zygomatic branch. Number 3 will be the posterior superior alveolar nerve. In the orbit, it going rise to 2 branches. Number 1 will be the middle superior alveolar nerve and this is the anterior superior alveolar nerve. So all this superior, there is a posterior, middle and anterior, they are break up and they are joined to form a superior dental plexus. This superior dental plexus is going to supply all the molar, premolar and incisor and canine teeth and adjoining gums. And next come to the terminal branches. This palpebral branch is going to supply the skin of upper lower eyelid. Our nasal branch is going to supply the skin of the side of the nose, and labial branch is going to supply the skin of the upper lip. So this is about the maxillary nerve. Thank you.
Make a cup of coffee.